This event is organized by the 25,000-member independent Hewlett-Packard Alumni Association, operated by former employees who volunteer their time, not endorsed or supported by the Hewlett-Packard Company. We help each other with life after HP, for example, decoding the annual enrollment packets. If you know someone who is leaving HP, our website has a checklist of things they need to do as soon as they know they are leaving. We are at hpalumni.com.
Welcome, current employees and alumni of Hewlett-Packard, to our Medicare webinar. These are the rules for the webinar. I'm Barbara Madden, Ameriprise Financial Advisor, ex-HP, and your moderator. We'll have a commercial from Scott Hamaguchi, Financial Advisor with our sponsor, the investment group of Addison Avenue of First Tech Federal Credit Union. I'll introduce our speaker. So let's start with Scott.
Thanks, Barbara. Well, we have a lot of good content ahead of us, so I'll be brief. I just wanted to say thank you on behalf of First Tech and Addison Avenue Investment Services. As you can see here, we're growing. We're now at about $7 billion in assets. We're the 9th largest credit union in the country, and that all goes back 60 years to our roots with HP and Tektronic employees. As you guys know, we have a nationwide footprint. Pretty much anywhere there was an HP site, there's a First Tech branch of some kind. I know we're actually building a new one out in Colorado, but bear with us. I believe that's opening soon. But we are available, and we're here to help out. As you guys know, we have full banking products, and I think the main thing on there is the bottom right corner, financial education. We believe in it strongly. We're honored to work in conjunction with Kurt, Barbara, and HPAA to provide things like this. If you guys need someone to contact, as Barbara mentioned, my name is Scott Hamaguchi, but more importantly, if there's something going on with the credit union, something you want to know more about, feel free to email me, Scott_Hamaguchi at AddisonAvenue.com. Yes, you're reading that right. It still says AddisonAvenue.com. Or you can call me directly at 408-863-6256. And with that, I will turn it back to Barbara.
The State Health Insurance Assistance Program, also known as SHIP, is a national program that offers one-to-one counseling and assistance to people with Medicare and their families through federal grants that support volunteer counseling programs in each state. For the past 17 years, our first speaker, Connie Corrales, has specialized in promoting the rights of senior citizens and disabled persons. She is the director of the Health Insurance Counseling and Advocacy Program, HICAP, at Sourcewise. This is the SHIP program for Santa Clara County in California. To find the State Health Insurance Assistance Program for your state, go to shiptalk.org. All righty.
Okay, thank you very much, and it's my pleasure to be here today. And a little bit of our company, I work with Sourcewise, and what we do is that we help seniors age well at home, and we provide expertise, education, and quality support services to Santa Clara County seniors, their caregivers, and also their families. We have many of the departments at Sourcewise. The most important, we have the Information and Awareness department that is in the entry into all these services into the community, and this is also something that you would be able to access wherever you are in the United States, and I'll let you know how you can get that information. I will be talking about the Health Insurance Counseling and Advocacy Program, and as Barbara said, it is also called SHIPS. Here in California, we're called HICAPs. In other states, we're called SHIPS. And we have counselors throughout most of the senior centers in Santa Clara County where we are here, but every area in California also has a HICAP that is our counterpart, and there is an insurance counseling and advocacy program everywhere in the United States, and as I said, they are called SHIPS. One of the things that we can point you to is if you go into the Medicare.gov website, and if you see at the end where it says Forms, Help, and Resources, you can go ahead and press that, and it sends you to choose an organization, and it will get you to the telephone number for the SHIP wherever you are in the United States. So what I'm going to be doing this afternoon is going to be going into an introduction to Medicare. I will be talking about all the parts and the coverage for Medicare. We're also talking about the premiums and also how you enroll into Medicare Parts A and Parts B. So we'll be talking about what the Medicare choices and the options are in the original Medicare, and we'll go ahead and talk about the cost and how a person can mitigate the cost to the Medicare gaps. We'll be talking a little bit about Medigaps, which are also called supplements to Medicare. And then we'll be talking about another option, and that is Medicare Advantage. And we will also be talking about the Medicare drug coverage. And we'll go ahead and have a final summary and final reminders. So what is Medicare? Medicare was put in place in 1965 by the Social Security Act, Title 18, and it is a federal insurance for people that are 65 years of age and older, and also for people that are under age 65 and disabled. For example, if a person is disabled for 24 months, then they are eligible to receive Medicare, as are also people that have Lou Gehrig's disease, the ALS, and anyone that has the end-stage renal disease. Once a person starts receiving dialysis for 3 months, they are then eligible to receive Medicare, even though they are under age 65. There are different parts of Medicare. There's the Medicare Part A, which we consider the hospital part of Medicare, the Medicare Part B, which is the medical part of Medicare, and then for you to get an idea, the Medicare Part C is the Medicare Advantage, which we know as the HMOs and the PPOs. They all fall under the Medicare Part C. And then, of course, everyone knows the Medicare Part D, which is a prescription drug coverage. So under Medicare Part A, it covers very important benefits. It covers a person when they are in the hospital. It covers a person when they are receiving skilled nursing care. Home health care is also covered under Medicare Part A, as is hospice care. Medicare Part B is what we consider the doctor part of Medicare. It covers a person when they receive doctor's services and as well as outpatient care. It covers home health care, diagnostic tests, physical and occupational therapy. It's all covered under Medicare Part B, as is durable medical equipment. And through the Affordable Care Act, now we have the annual wellness visit. And also through the Affordable Care Act, now we have the preventive services, which we had in the past, but now there is no more co-payment. So this is called Medicare Parts A and Medicare Parts B are called Original Medicare or Fee-for-Service. So a person can go ahead and stay with the Medicare, Original Medicare Parts A or B, or they can assign their Medicare to what is known as the Medicare Advantage, the Part C. So in that case, they will receive all the Medicare Parts A and Medicare Parts B services through the Medicare Advantage. Another part to Medicare is the Part D, which is the outpatient prescription drugs. And in most areas, your Medicare Advantage will also cover the Part D, the prescription drugs. So what is not covered by Medicare Parts A and B? And this is one of the questions that we get very often. One of the things I like to point out that it is a misconception that long-term care is covered by Medicare, when in fact a very small percentage of it part is covered under Medicare. Routine dental care is not covered under Medicare. Dentures is not covered under Medicare. Vision is not covered under Medicare. However, if a person has cataract surgery, now that is medically necessary and is covered by Medicare. Cosmetic surgery is not covered under Medicare, nor is acupuncture or hearing aids and exempts for fitting the hearing aids. And the Medicare.gov website, if you need to get a complete list, will give you all the list of what is not covered under Medicare. Now, for the 2015 Part A premiums, if a person has earned 40 credits, which is equivalent to about 10 years, then they will receive Medicare Part A without a premium. It'll be $0 per month. If a person has worked 30 to 39 credits, then the premium is going to be $224 per month. And if they have worked less than 30 credits, the premium per month is going to be $407. A credit simply means $1,200 in earnings in 2014, and there's a 4 credit maximum per year. So as you can see, this is an entitlement. If a person has worked the 40 credits, which is equivalent to about 10 years of work, they will get it for 0 premium. If not, they will have to pay for the premium. So now, Medicare Part B premium in 2015, if a person as an individual earns less than $85,000 and a joint tax return of for a couple with less than $170,000, then the premium is $104.90. And this is based on 2 years prior income tax return, and they look at the modified adjusted gross income. And as you can see, as the income is higher, there will be an increase to the premium, and this premium is per person. So how does one enroll into Medicare? To enroll in Medicare Parts A and B, a person will go to Social Security Administration. One of the things that we will be looking at is that there are quite a few gaps to Medicare, so a person may want to buy a supplement to Medicare that's also known as a Medigap, and in that case, they contact the insurance company, or if a person wants to join the Part C, they will also contact the Part C, the HMO, or the PPO. So they will contact the insurance company or the 1-800-Medicare, or they can enroll with the Medicare.gov website. Now, the Medicare Part D, they also go to the insurance company as well as 1-800-Medicare or Medicare.gov website. So with Medicare, there are different enrollment periods. The initial enrollment period for Parts A and Parts B is a 7-month period that begins 3 months before the month of eligibility and ends 3 months after the month of eligibility. So in this example, a person turns 65 or was first eligible to get Medicare in October, they can enroll July 1st and it ends January 31st. You do not have to be retired in order to enroll in Medicare, because one of the things that happens is a lot of times people retire at age 62, and at that time they are already in the books, and then Social Security will send them their Medicare card. Otherwise, if a person has turned 65, they should contact Social Security about 3 months before eligible. An enrollment period is based on the entitlement month, as I said. So special enrollment period for Medicare Part B, and this is a very important period that you can enroll any time that a person is working or within 8 months after the first month active employment ends or the employer coverage ends, whichever happens first. You have to have employer group or union group health care, and it's coverage is based on active employment. And this is one of the slides where we have a lot of problems, and that is because the law says that a person must be actively working and covered under the individual's or the spouse's active employment. And the warning is that COBRA does not count as active employment. So this is one of the times that we suggest that you contact a SHIP or a HICAP office if you would like some more information. So what happens if you miss your initial enrollment period or your special enrollment periods for Medicare Parts A and Parts B? Then you fall under what's called the general enrollment period. And that general enrollment period is from January 1st through March 31st of each year. The coverage is not effective until July 1st, and if a person chooses to delay getting Medicare Parts B, once they are eligible, they could have an additional 10% penalty for each 12-month period that they were eligible but did not enroll. And the penalty is permanent for as long as they have the Medicare Part B. And this is just a sample of the Medicare card. And I usually go in this card, and just to point out that this very important information, it has the name, it also has a Medicare number, and it has when Medicare Part A became effective and when Medicare Part B became effective. So one point for you to keep in mind is if you're calling Medicare, the 1-800-Medicare number is there to, first of all, call after 5 o'clock when the rest of the East closed, or West, if you're in the West, is closed. And also when you call the number and you get to the prompts where it says press this number and press that number, just say the word agent and it'll get you to a live person. So that's one thing that helps you avoid the 40 minutes wait. So what are my choices? You can go ahead and choose and stay with Medicare Parts A and Medicare Parts B, but there are quite a few gaps, so a person may go ahead and get a Medigap or what's called a supplement to Medicare, and they may go ahead and get the Part D, which is a prescription drug coverage. Or a person may go ahead and assign their Medicare to the Medicare Advantage, which is the Part C, and the drug is usually included in this. So what happens with original Medicare, with Medicare, a person can have Medicare Parts A, Parts B, or both, and they can go to any network, or any provider that accepts Medicare. There are some additional costs, and these costs will be the deductibles, the co-payments, and the co-insurance. So one of the examples of what the costs to Medicare are is, for example, when a person is admitted to the hospital before Medicare pays anything, there is a deductible that is $1,260 deductible. The way this works is per benefit period. So the benefit period begins the first day that you are admitted to the hospital, and it ends when you are out of the hospital for 60 days. If a person goes back within 60 days, they do not have to pay the Part A deductible, but if they go home and stay out longer than the 60 days, they again will be responsible to pay the Part A deductible again. So as you can see, this could be once or twice or 3 times a year, depending on the illness. Then from day 61 to day 90, then the copayment per day is $315. And from days 91 to 150, the copayment doubles to $630 per day. So this is an example of the Part A cost, and this is one of the parts. If a person goes into a skilled nursing facility, Medicare will pay for everything from days 1 to 20. From days 21 to day 100, they pay for everything except for a copayment of $157 per day. And after 101 days, Medicare does not pay anything at all. So the beneficiary will have to pay the entire cost of the stay in a nursing facility. One thing to keep in mind in this slide is the word skilled level of care. You have to really underline that word because it cannot be custodial and it cannot be personal care. To just give you a very brief example, if a person is in a skilled nursing facility and they are receiving 5 days of physical therapy, that's considered skilled level of care. If the doctor comes in and then drops into 3 days of physical therapy, now that's considered personal care or custodial care. So this is one of the times as an advocate that you want to be able to talk to the doctor and say, my mother or father is doing very well, receiving 5 days of physical therapy. Can we keep them on 5 days of physical therapy? And that is the difference between Medicare paying for it or not paying for it. So this is one time that is very important to keep that in mind. So what are the costs to Part B? First of all, there is a deductible, and that deductible is $147. And then Medicare pays 80% of approved Medicare charges, and the beneficiary will pay 20%. So one of the things that it pays is what we reviewed, the doctor cost, the outpatient, durable medical equipment. Medicare pays 80%, and the beneficiary will pay 20%. So because of the gaps that we talked about, a person may go ahead and choose a Medigap, which is also known as a supplement to Medicare. So in this case, what they do when they go to the doctor is that they will have a Medicare card, and then they will also have a Medigap card that's also called a supplement to Medicare. So what is a Medigap or a supplement to Medicare? It's insurance that is sold by private insurance company. And one of the things that it does, it will pay for the Parts A and Parts B out-of-pocket, Medicare Parts A and Medicare Parts B out-of-pocket costs, or the gaps. There are 10 standardized plans, and even though I have to stay very unbiased and objective, I will tell you that the most comprehensive plan in this list is the Plan F as in Frank. So if a person buys a supplement to Medicare, they will go ahead and get a Plan F, and it's going to take care of everything that Medicare does not cover it as long as Medicare approves it. And that's one of the things that we tell our clients is if Medicare denies a service, be sure to contact the doctor and make sure that it was coded correctly, because that's the difference between Medicare paying for it or not paying for that. Okay, so one of the things that you do have is you have to have both Medicare Part A and Medicare Part B at the time of the coverage. So when can you purchase a Medigap? The very first time that you can purchase a Medigap is called an open enrollment period. That is a period of 6 months from the effective date of your Medicare Part B, in which every company has to accept you. There is no health screening allowed. So regardless of what your medical condition is, they have to accept you. And then also when you lose certain kinds of health coverage, for example, employer coverage or COBRA, you also have this guaranteed issue right. And then bottom line, anytime that a company will sell you one, because if you have good health, they will sell you a policy. So now Medicare Part C, which is the Medicare Advantage, what happens is at this point, you will go ahead and you assign your Medicare, and now you have a Medicare Advantage card, and this would be like an HMO or a PPO. So the Medicare Advantage plans, which are Part C, you have to live in the Plans County service area. You have to have both Medicare Parts A and Medicare Parts B, and you continue to pay for the Part B premium. And then you will pay for any Medicare Advantage Part C plan premium. There is no health screening, with the exception that you cannot have end-stage renal disease. So there are 3 types of Medicare Advantage plans. One of them is called the Health Medicare Organizations, which is, Health Maintenance Organizations, which is the HMOs, the Preferred Provider Organization, which are the PPOs, and Special Needs Plans. So with the Medicare Advantage plans, you generally will have to get the care and services from the plans network. You have to select and use the primary care physician, and he or she is the one that directs your care. The co-payments are set by the plan, and if you go outside of the plans network, you may have to pay out of pocket. Through the Affordable Care Act, there are now new maximum out-of-pocket limits. The Medicare Advantage plans work a little bit, Medicare Advantage PPO plans work a little bit different. Generally, they will have a wider network. You do not need to have a referral to see a specialist, and you do not need a referral to see out-of-network providers. The co-payments, again, are set by the plan, and you will usually have to pay more for out-of-network care. Special needs plans, there are plans that are for dual eligibles, for people that have Medicare and Medi-Cal. And there's also for people that have certain chronic conditions, like such as diabetics, chronic lung disease, cardiovascular disorder, or people that are living in a nursing facility. So the enrollment for the Medicare Advantage plans are the same initial enrollment period, which coincides with the Medicare Parts A and Parts B initial enrollment period. The special enrollment period, and this is one thing to keep in mind, that is 2 months after the other coverage ends. The annual enrollment period, which right now we are in October 15th to December 7th, and this is the annual enrollment period. And also any time that you enroll into a 5-star rated plan. In this area in California, so far we have Kaiser as a 5-star rated plan. We haven't heard anything for the other plans yet, but it's still early. So prescription drug coverage, Part D, came into effect in 2006. So now what happens, you have a Medicare card, you have a Medigap card, and now you will also have a prescription drug card. It has a Medicare RX. So if you are in a Medicare Advantage, your Medicare Advantage, you will carry the one card, and in the corner, it'll say Medicare RX. It is available to anybody that has Medicare Parts A and Parts B, and is provided to what are called standalone plans, prescription drug plans, Medicare Advantage plans, some employers and unions. There are also the premium adjustments. They kind of mirror the same as Part B, with additional premium paid for those people that have income levels higher for an individual than $85,000, and for a joint tax return greater than $170,000. So this amount is paid if your income level is larger. So the enrollment period for Part D is usually 2 months after the other coverage ends, and it also has the initial enrollment period that also coincides with your Parts A and Parts B. The special enrollment period, like I said, is the 2 months, and that's really important because sometimes this is where we see people missing that enrollment period of 2 months. And right now, the annual enrollment period, which is a very important period for everybody right now because it's only October 15th to December 7th. And any time that there is a 5-star rated plan, up to now we have not had one, so we're still keeping our fingers crossed. So there's none so far. So one of the things to remember with this is that creditable coverage ends. One of the examples for creditable coverage would be employer or COBRA drug coverage, and you have to sign up for a Medicare Part D plan within the 2 months after the coverage ends to avoid the penalty. Even though it's voluntary, there is a penalty if you do not join one, and the next opportunity to join one would be the annual enrollment period, which is October 15th to December 7th, and it's effective the first day of January. So potential consequences for missing your enrollment periods are, for Medicare Part B, is that you may have to have a 10% penalty for every 12-month period that you could have had Medicare Part B but did not enroll in it. So you delay with getting your medical coverage. Part D, the premiums increase is 1% for each month that an individual could have been but was not enrolled in Part D, and it could also delay your drug coverage. A Medigap, denial of purchase due to pre-existing condition. So one of the last things that I would just mention very briefly is that we have been tasked, it's very important, is to prevent Medicare fraud. And one of the things that we tell beneficiaries and clients is to protect your Medicare card as if it was a credit card. And one of the parts is if you suspect any fraud, anybody asking you for a Medicare card, offering something, just go ahead and contact us at this website or telephone number. And to contact your state health insurance assistance program, the SHIP, for anybody outside of California or in California, you go to Medicare.gov, as I showed earlier on the slide. You go to the Forms, Help, and Resources tab, click the phone number and website, and then you select, do you want to find a specific organization, and click SHIP and enter your state, and it will give you the telephone number for your HICUP and SHIP, and it will also go ahead and you can use this telephone number if you need any services for seniors. So with that, this was a very brief overview of Medicare, and I appreciate very much being here. And it's very difficult to go into everything in half an hour, but you have the telephone numbers that you can contact us. So I would like to thank you very much.
Thank you. Now our second speaker is David Rue, is a client analyst with 16 years experience with insurance and the last 7 years in Medicare. The Aon Retiree Health Exchange will help the alumni compare the different Medicare plan options in your area and find the plans that best suit your individual needs.
Welcome, everyone. Again, my name is David Rue with the Aon Retiree Health Exchange, and it's my pleasure to be here today to speak with all of you. My main goal today is to make sure you leave this presentation with a better understanding of how we can assist you through the process, compare plans, and the ongoing support as well. So the Aon Retiree Health Exchange is a private exchange. Think of it as a marketplace where you're able to compare different plans, the prices, the different options available in your area. You'll be getting a dedicated benefits advisor that will give you one-on-one support throughout the whole process and help you find the plans that best suit your individual needs. What we are not is we are not the public exchange like the Affordable Care Act. So just keep in mind, we're a private exchange. We've been around a lot longer, and the private exchanges are for people that are Medicare eligible. The public exchange is for people under 65 that are not Medicare eligible. So a little bit about the AIM Retiree Health Exchange. So we have served millions of employees, retirees, and their families for over 20 years now, and we offer a broad range of health plans. So right now we represent over 90 different insurance carriers throughout the country. Companies like United Healthcare, AARP, Mutual of Omaha, Aetna, Blue Cross Blue Shield, Humana, prescription drug plans like CVS Caremark, Express Scripts, United Healthcare, and many more. And we have a lot of robust tools and services that help you compare the different plans, including our website, which I'll be going over in a few slides. And we're also recommended by the National Council on Aging. So this map right here shows you the 5 different locations where our benefits advisors are. The main things to know is we have benefits advisors, they all live within the United States, and we have benefits advisors that are licensed and trained in all 50 states. And our benefits advisors are licensed, certified, and trained to offer Medicare insurance products in the states that they represent, and they are all salaried employees. This means they have no financial incentive to enroll in one plan through one carrier versus another plan through another carrier. Their main objective is to help you find the plans that best suit your individual needs. And essentially, we'll take all this complex insurance information and present it to you in a way that you will be able to understand. But the decision about the plans that you are going to be enrolling is yours to make with the assistance of your benefits advisor. And that you will have the same benefits advisor throughout the whole process. Now, today you're going to learn about the different options. And after this, you'll be able to set up an appointment by calling up the 1-800-975-0355. And if you have power of attorney, we can work directly with you. All we need is verbal confirmation. And if you have any friends or family, I would recommend getting involved in this process. And your benefits advisor can actually do a 3-way call if they live in a different location. Now, there's a few things that we ask that you have on hand for your initial phone appointment with your benefits advisor. First is your Medicare card. That's your red, white, and blue card. Second is a list of any doctors or medical facilities that you want to continue with. And third, and this is very important, is a list of any medications that you're currently taking. And your benefits advisor will be asking for the name of the medication, the dosage, and how many times you're taking that per month. And the reason we ask for that is because in one area, there could be 25 different Part D prescription drug plans available. And by us knowing which medications you are taking, we're able to determine of those 25 so-called prescription drug plans, which ones are going to give you the lowest overall cost for the year. So we'll find the drug plans that are tailor-made to the prescriptions you are taking. Now, your benefits advisor will call you on the phone at the specific date and time of the appointment that you set up. And for an individual, the initial appointment is going to take about 45 minutes to an hour. And you can also, if you're both Medicare eligible, you can do it as a couple. That's going to take a little bit longer. And we really need all that time because your benefits advisor is going to go over information about Medicare. They're going to go over the different plans that are available in your area, including the benefits of those plans and the cost of those benefits as well. They're also going to ask you various questions about your specific situation, getting to understand your needs and your preferences. Questions like, are you concerned about prescription drug costs? Do you travel throughout the country? Do you have any doctors that you want to continue with? So these are all important pieces of information that help you determine what's going to be the right plans for you. And since you have a choice with HP, basically what your benefits advisor will do is help you decide, first off, does it make sense for you to stay with the HP group plan moving forward or possibly move to the individual plans? And if you want to move to the individual plans, then we'll help you decide which of those plans would work best for you based upon your specific needs. And they will be able to mail you out hard copies of all the plans that you're interested in for you to review, or they can email you out the information, whatever you prefer. And they'll give you all the time that's needed for you to review the plans and find the plans that best suit your needs. And once you find the right plans, then they will assist you through the application process. And again, you can stay with the same benefits advisor throughout the whole process. Next, I'm going to talk about the different options for choosing and enrolling in plans. So it's very important to note all the individual Medicare plans, these are all individual plans. There are no plans available that will cover both you and your spouse under the same plan like the HP plan does today. That's why we're looking at you all individually to help you determine what's going to be the right plans for you based upon your needs. And then if you have a spouse, we will do the same for them. You may enroll in the same plans to the same carrier, or they could be different especially for prescription drug plans, because you may not be taking the same prescriptions as your spouse is doing. Now, if you are leaving the group plan, you have something called a guaranteed issue. This means you're guaranteed to be accepted into most of the letter plans without answering the health questions on the application. Now, this window of opportunity only lasts for a few months. I believe in California it's actually a 6-month window. It's a little bit longer. Typically, it's a 2-month window after you leave the group plan. California, it's a 6-month window. But this allows you to move into a Medicare supplement plan, again, without answering any of the health questions on the application. And for any of you turning 65 in the future, you will have the same guaranteed issue window. Actually, you have the open enrollment window where you can actually enroll in any of the plans available in your area without answering any of the health questions on the application. Also, if you're over 65 and you're still working right now, when you do retire down the road, again, you'll have the same opportunity. If you want to leave the HP group plan, you have this guaranteed issue window. Now, since with HP, unlike a lot of other companies I work with, you have a choice of either remaining on the HP plan during annual enrollment each year or moving into the individual Medicare plans. Now, since this is a voluntarily thing, you're not losing your group coverage if you leave the HP group plan. There are 21 states where if you voluntarily leave the group plan, it's guaranteed by law that you get a guaranteed issue, including California. In the other states, it's determined by the carrier that you enroll in, and your benefits advisor will know all that information for you. Now, the guaranteed issue letters are A, B, C, F, which is definitely the most common supplemental plan because it is the most benefit-rich plan as well, and it fills in all the gaps that A and B does not cover, and also K and L. Now, the other letters are also determined for a guaranteed issue by the individual carriers, and your benefits advisor will give you information about that as well. Once you decide on plans, there's a couple different options for enrolling in the plans. The first option is actually filling out the application via our website. And in a few slides, I'm going into more information about our website. But on our website, once you set up your account, you're able to look at all the different plan options that are available in your area that we represent. And if you find a plan that best suits your needs, you can actually fill out the application online. And once you submit it, you will be prompted to call up the AIM Retiree Health Exchange to complete your enrollment with what is called a verbal signature. You'll just simply confirm over the phone that you want to enroll in that particular plan. And we record that information, then we send it to the insurance carrier for processing. Second option is called a telephonic enrollment. And right now, we do over 95% of our enrollments this way. And here's how that works. You'll be on the phone with your benefits advisor. Once you decide on a plan that best suits your needs, they will actually walk you through the application over the phone. They'll be filling it out. You'll be answering questions. They'll get a verbal signature at the end of the call, and then they'll send that information to the insurance company for processing. For the first two options, you will actually get a copy of the application mailed to you from the insurance company once we submit that information. The third option is a pre-fill paper application, and we will be able to pre-fill the majority of the information on the application when we're on the phone with you before we mail it out to you for your signatures. Now, in terms of enrollments, first you have a special election period because if you're leaving the group plan, this is between November 1st and December 31st. Again, it actually lasts 2 months afterward, depending if you're going with a Medicare Advantage plan. Supplement plans actually give you 63 days after you leave the group plan to enroll into the plan, in most cases with a guaranteed issue. Next is the open enrollment. So Medicare just changed the annual enrollment to, it's called open enrollment now, and this is October 15th through December 7th every year. During this time frame, you're able to shop around and change your Medicare Advantage plans and your Part D drug plans. And you should review your situation at the end of each year, especially for your prescription drug plan, because you may not be taking the same prescriptions as you did the year before, and your plan may not be covering the same prescriptions as it did the year before. So we will mail you out communication well in advance of open enrollment each year for you to set up a time to speak to your benefits advisor, and they will review your current situation. They'll look at your current drug list, and they will help you determine, does it make sense for you to stay where you're at? And if you like the plans that you're in, they will automatically roll over year after year as long as you pay your premium, or possibly move to another plan, or again, during the annual enrollment each year you can move back into the HP group plan. So that's another option that you have at the end of each year as well. And that's a great option to have. We don't have any other clients that are allowing individuals to move to the individual Medicare plans, basically test drive it. If they don't like it, then you can move back into the HP plan at the end of any year that you like. Also, if you're turning 65, you have the initial enrollment period, and we will mail you out communication 3 months before the month of your 65th birthday for you to set up a time to speak to a benefits advisor. And if any of you have TRICARE for Life or VA coverage, make sure you provide that information to your benefits advisor. Next, I'm going to go over the different options for paying your premium once you enroll in the plans. So the first option is the traditional method, where you'll simply write out a check and you'll mail it in to the insurance carrier each billing cycle. The second option is the preferred method, where you'll set up an automatic debit that will come directly out of your checking or savings account. And the reason we prefer this is once you set this up, you don't have to worry about it again. It will come out automatically on a monthly basis, and your benefits advisor can help you set that up. Third option, and this is only for Medicare Advantage plans and Part D drug plans, you can have your premium automatically deducted from your Social Security check. Now, next I'm going to talk about the health reimbursement account. So if you are eligible, HP will credit a health reimbursement account starting January 1st, 2015, if you enroll in at least a medical plan through the retiree Health Exchange. So if you enroll in a medical plan and a drug plan through the exchange, this account will automatically be set up for you, and whatever amount you qualify for, that full amount will be put into your account day one of next year for you to use. And some of you may have received information in the mail about how much you qualify for. If you do not know, when you have your phone appointment with a benefits advisor, they will tell you exactly how much you qualify for. And if you have a spouse that's Medicare eligible, they will tell you exactly how much they qualify for as well. Now, with the reimbursement account, you can get reimbursed for Medicare supplement plan premiums, Medicare Advantage plan premiums, Part D drug plan premiums, and also your Part B as in boy premium, that one that usually comes directly out of your Social Security check. Now, throughout the year, as you're using your plans and you get reimbursed for eligible out-of-pocket expenses, if you run through the full amount in your account before the end of the year, you will continue to pay your premium and eligible out-of-pocket, or your premium and out-of-pocket expenses to the insurance company and your doctors, and you simply won't get reimbursed for the remainder of the year. On the flip side, if you have money left over at the end of the year, that will roll over to the next year for you to use. And if you and your spouse are both Medicare eligible and you roll in plans through the retiree Health Exchange, you will have a joint account. So you both get individual allocations, but that will be a co-mingled account, meaning, and this is a good option to have, if one of you has more health issues than the other person, you can actually get reimbursed for more of those funds and vice versa. Also, I want to talk about the retiree. So the retiree is the anchor on what goes on. So there's a couple of different scenarios to think about. So if you're a retiree and you have a spouse, and the retiree leaves the group plan and goes to the retiree Health Exchange, the spouse has to leave as well, and that's in the rules. Second scenario, if the retiree is in the HP group plan and the spouse leaves, the spouse can leave, but they will not qualify for any HRA allocation. So it's based upon what the retiree does and what's going to go on. If they stay in the HP plan, it's a good chance that the spouse is going to do the same thing. If they leave the HP plan, the spouse has to leave the plan with them. Now, this is just a diagram on how the reimbursement works. So basically, the main thing to know is you always have to pay your premium and eligible out-of-pocket expenses to the insurance company or your doctor first before you get reimbursed. You pay first, it goes to the insurance company, and for a lot of the companies we represent, they have something called automatic reimbursement, which means you pay your premium to the insurance company first. The insurance company then notifies the retiree Health Exchange that you paid that premium, and we're the ones that administer the HRA account. Once we receive that information and there's funds available in your account, we will either cut you out a check and mail it to you, or you can set it up where that money goes directly back into your checking or savings account. So for eligible out-of-pocket expenses such as Part B premium, you actually will submit something called a manual claim form directly to the Amway Retiree Health Exchange with proof of payment, and then we will reimburse you. And you're going to get a lot more information about the reimbursement account from your benefits advisor. Also, once you enroll in plans through the Amway Retiree Health Exchange, we will send you out an HRA kit in the mail. This will give you a lot of information about the reimbursement account, how it works. Also included will be your manual claim forms. Next, I want to talk about the different tools that will help you through the process and ongoing. So one of the great things about enrolling in plans through the Amway Retiree Health Exchange is our advocacy services. So let's say you enroll in a plan starting in 2015. If you have any issues after that January 1st with access to care or prescription drugs, any claim denials or billing disputes with the insurance company, our advocacy group will go to bat for you. What you always want to do first is call up your benefits advisor, let them see if they can resolve the issue, and they can resolve a lot of issues, but if they can't, then they will send you over to our advocacy group, and you will be assigned an advocate that will work that case from start to finish. And they actually pioneered this industry back in 1999. Right now, they work with over 400 clients, and they really know what they're doing. They have, on average, over 18 years experience in this industry. So I want to show you a few real examples on how they've helped out individuals in the past. So the first example is an individual received an unexpected bill after going to a rheumatologist. And what happened was the provider miscoded the diagnosis, and as a result, the charges were not eligible for Medicare. So this person could not get it resolved, finally worked with an advocate. And the advocate actually worked with the provider to correct and reprocess the bill, and once it was reprocessed, the advocate communicated the actual liability to the retiree. Second example is Medicare denied a claim indicating Medicare was not the primary payer. This person finally worked with an advocate, and the advocate found out that they indeed had Medicare A and B as their primary coverage, and they had secondary coverage as well. So the advocate facilitated refiling the claim with Medicare and then forwarded the explanation of benefits to the secondary carrier for payment. Last example is an individual was denied a request for a wheelchair. Medicare claimed it was not medically necessary. And this person fought tooth and nail, could not get it resolved, finally worked with an advocate, and the advocate retrieved all their medical records that pertained to this issue, got everything in order, resubmitted it to Medicare, and Medicare actually approved the wheelchair. And once approved, the advocate made arrangements for home delivery of the wheelchair to that individual. Next, I want to talk about our website. So the website is retiree.aon.com/Hewlett-Packard. And there's a lot of neat things you can do on our website once you set up an account. First off, you're able to confirm your enrollment appointment. You're also, if you're turning 65, you're able to confirm your enrollment appointment. You're also able to add in all your prescription drugs online. And again, they're going to ask for the name of the prescription, dosage, and how many times you take that per month. Once you add in your prescriptions when you're looking at any of the drug plans available or any Medicare Advantage plans that include drug coverage, you're able to see basically what your drugs are going to cost you throughout the year. So it's really good information to have. You're also able to confirm your phone number and your address online. You're able to compare all the different plans that are available in your area. And if you like a plan, you can actually add it to the shopping cart. And if you do this before your initial appointment, phone appointment with your benefits advisor, and you add your drugs in, all that information will be uploaded to their system before you have your call. So they'll know what prescriptions you're taking already, and they'll know what plans you're interested in. Also, there is a link to the HRA contribution. So you can click that at any time of the year, and you'll know exactly how much you've been paid out and how much you have left in your account. We will also be mailing you out a statement every month about your HRA account as well. And this is the landing page. Once you sign into the website, you'll get, if you are turning 65, again, we will mail you out information about an upcoming phone appointment where you can schedule that. Also included in there will be instructions on how to set up your account, including an ID number. So once you set up your account and activate it, you will be able to set up your own unique username and password that you can use every time that you log in. If you're over 65 and you're simply just calling in, they can give you your ID number over the phone to help you set up your account as well. And if you ever have any issues, you can actually call up the Amway Retiree Health Exchange and they can walk you through the process as well. So this is just a timeline. Right now, there was a communication mailed out in early October about the Amway Retiree Health Exchange. I'm actually doing a couple on-site health meetings, or at the health benefits meetings, one in Palo Alto. I'm going to Roseville, California, and then Boise, Idaho. I have a colleague that will be in Andover, Mass. Fort Collins, Colorado, and then up in Corvallis, Oregon as well. And we will actually have a breakout session that will actually go into a little bit more detail than the slides that I'm doing today as well. Your annual enrollment is for HP is November 3rd through the 21st. And also starting November 1st, you can look at the different plan options available in your area outside the HP plan. And again, we will help you decide based upon your needs. Does it make sense for you to stay where you're at for next year or possibly enroll in the individual Medicare plans? And once you're in the plans, you're not stuck in them. If you don't like them at the end of each year, you can move back to the HP plan if you like. And if you're turning 65, again, we will mail you out an education kit along with a welcome letter 3 months before the month of your 65th birthday. Included in there will be some general information about Medicare, also a specific date and time for your phone appointment, and a phone number that you want to call up the number to either confirm that appointment or reschedule it for a better time. Have your Medicare card available, your doctors and your prescription drug information for your phone appointment, and then you want to complete your enrollment. And if you're going to enroll in plans, turning 65, we want to make sure you review the plans and enroll in plans by the first day, or actually before the first day of your 65th birthday. And this is the number to call up. If you want to set up an appointment to speak to a benefits advisor, this number's live. It's 1-800-975-0355. You can call this number Monday through Friday, 8 a.m. to 8 p.m. Central Standard Time. And I would recommend just look at your options available to you. I know when I went to the health fairs last year and the year before, the people I talked to, a lot of them actually were looking at the numbers and how much they're paying right now for their HP group plan, and looking at what they're going to be getting in their health reimbursement account and how much the individual Medicare plans cost. And some of the people actually told me that it was a no-brainer for them to move over to the individual plans. But again, everybody is different in what's available and how much it's going to cost them. So that's why you want to set up an appointment with the benefits advisor, look at your situation, and help you decide to either stay where you're at or possibly move to the individual Medicare plans. All right, so that's the end of my presentation. So thanks again for your time. And
Do we have any questions?
Yeah, I believe we're going to go to the questions.
Okay, great.
You have questions?
Good.
Go ahead. One thing I think you want to make clear is the role of Aon Exchange in this context is with people who are classified by HP as a retiree.
Yes.
However, what you've described applies to anybody who works with a health insurance agent to figure out what to do to supplement or whatever with their Medicare.
Yeah, we can actually work with anybody that has Medicare A and B. That's the rule. Anybody within the 50 states, as long as you have Medicare A and B, we can work with you.
Oh, good to know.
Okay. It's just that they won't get the HP subsidy.
Correct. Absolutely.
That depends
Correct.
on 10, 20, 30 years of service and so on and so forth.
And other
Excellent.
variables for digital as well.
Excellent.
Yep.
Okay. Another question. Does it cost to use Aon?
So this is a free service to you. A lot of people, I've had a question. I mean, I've done hundreds of presentations, and one of the main questions is, how do you make money? So we make money by everybody that we enroll in the plan through whatever insurance carrier is. The insurance carrier pays us a commission to enroll you in the plan. And we get a certain trailer each year if you stay in that plan. That's how we stay in business. But it's a free service to you along with the advocacy as well.
Question. If I continue to work past 65 and retire at 67, how do the enrollments change?
Okay, if you continue to work past age 65, as long as you are covered by present employer, actively working and covered by present employer, you can delay getting your Medicare Part B, and at the time that you stop working, you go into what's called a special enrollment period.
And there's a time limit.
There is a time limit, and that is 8 months period. And that 8 months period is whenever the employer group health plan ends or employment ends, whichever happens first.
Does the option to return to HP apply to all states?
Yes, it does. Yes. And let me add on to the other one as well. So if somebody's, let's say, age 67, currently working, or actually 65, let's say they work a couple more years for HP, At the time that they're retiring, they have a couple options. They can remain with the HP Group retirement plan, but I also would recommend 2 months before you know you're going to retire, that's when your window opens up to look at the different Medicare plan options, including supplemental, Medicare Advantage, and Part D. You can set up a time to speak to a benefits advisor, and again, they will help you decide should you just remain on the HP plan or possibly move to the individual Medicare plans.
Does the Medicare plan need to start coverage on January 1st, 2015, or any time you decide to retire within 2015?
Actually, anytime that you decide to stop working, you will go ahead and sign up for Medicare. So whatever, if it happens at your birthday and you are not working, is during the remainder of the year, the annual enrollment period is for ongoing, people that have ongoing Medicare. Whenever you are effective for Medicare Part B is when your enrollment, when you can use your enrollment periods.
If we are currently on TRICARE, does this Aon service apply?
Yeah, so with TRICARE for Life, and this is for people that have been in the service for 20 years or longer. Actually, my father-in-law is on TRICARE. So what you want to do is you want to be very careful with TRICARE, because if you enroll in a Part D plan, or let's say a Medicare Advantage plan through the Amway Retiree Health Exchange, that will supersede your TRICARE coverage, which means A and B will pay first, then you will be working under the rules of that Part D plan along with the donor hole and all that. So if you have TRICARE for Life, I would always recommend talk with the TRICARE representative first before you talk to us about plan options. Because again, it may mess with your TRICARE, and TRICARE for Life is about the best coverage you can get. So for most people, they're not going to want to mess with how that's working.
What do you do if you're on disability under 65 and HP retired? I don't think any of us can handle that one.
HP retired. If you are on disability under 65 and you have been disabled for 24 months, then you would become eligible to receive Medicare.
Okay. If I drop the retiree HP health plan when I return to work, am I eligible for the Aon plan?
If I drop the HP plan when I return to work. Okay, so they're going to be actively employed again?
Yeah.
And they don't like the HP group plan, they can actually...
I think that one you want to talk to the benefits center about.
Yeah, because that's...
Okay.
Usually, I mean, there's very few people at all that would drop an active plan to actually move to the Medicare plan option.
If people are on an HP plan, it is possible to drop. But in these special cases, you really need to talk to the benefits center.
Definitely.
They do an excellent job. HPA members report excellent results from talking to the benefits center. If you don't get excellent results, just ask to escalate. And if that doesn't work, we have a mechanism in HPAA to escalate directly to HP corporate. So we can help you if the rare cases when things don't work out with the benefits center, which is a different division of Aon Hewitt.
It is.
It's a whole different company.
It is. Well, same company, different division.
Yeah, different division.
Yeah.
How many months before 65th birthday should a person get in contact with Aon on this whole thing?
So we will mail you a communication around 3 months before your 65th birthday.
Okay.
So we will start the communication out. Again, you'll have a welcome letter, information about a phone appointment. What you want to do is if you want to speak to us about different plan options, you're going to need to call that number up, because by law, we can't start the whole process until you call us up first. So you can call up to either schedule that appointment or reschedule for a better time, and then we can start the process by looking at the different plan options.
Okay. Here's a person who's getting PRP. Their leaving date is in April, March. Basically, HP does a very good job of contacting you as part of terminating HP. And I don't think I've ever had a report from a member where people weren't contacted and their specific issue resolved. So I think, people are leaving all different dates, and they do track your age, so you know whether to have Aon contact you or not. So you will get a packet. You will get more stuff in the mail than you can believe possible when you leave HP. Momentary pitch for joining the HPAA. Part of what we do on the forums is help people sort out and decode all the material you get, some of which is legal boilerplate, and some of which is extremely important stuff that has important deadlines. And that's one of the things we help with if you join at hpalumni.com. A person, this is a Social Security question I'm going to skip over. What happens if I start Medicare coverage and then start working for an employer with good group medical coverage?
Then you can go ahead and drop your Medicare Part B, and then go ahead and once you stop working, you can go ahead and enroll in Medicare Part B again.
Would you go over the issue when someone has a spouse? Here's a case where the spouse is 7 years older than the retiree.
Yeah. So let's say retirees under 65, the spouse is over 65. So again, it's all dependent on, it's anchored on what the retiree does. So the retirees under 65, they're going to remain on the HP plan because they can't move to the individual Medicare plans. Their spouse does have the option of moving off the HP plan, but that's not really the case. Most people would not do that because if they move off the HP plan, they will not get any HRA subsidy because the retiree is still on the group HP plan. If the retiree is over 65, the spouse is under 65. Here's another one. And the retiree moves off of the HP plan, the spouse is going to get kicked out of the under 65 HP plan. So the retiree is going to, I always tell them, stay on that until your spouse turns 65. And then you can decide what you want to do from there. Again, it's always dependent upon what the retiree does.
Does Aon help find dental and vision insurance providers?
Yes. So we have a couple different comprehensive vision and dental plans that we work with. And if you're interested in those, simply tell your benefits advisor. They can provide you more information on that.
I've been an Aon client for a year. How do I find out who my advocate is? If you call in, they recognize your phone number and send you to someone, right?
Yeah, they will. Yeah, so they'll have your number, they'll have your name and your information on file as well.
Yeah, and if your advisor isn't available, someone else will help you.
Correct.
Yeah, it's a very nice system. On the HRA plan, how do you find the amount allocated?
So I would simply call up the AIM Retiree Health Exchange, and they can tell you how much you qualify for.
Yeah.
And it hasn't changed for 2015. It's going to be the same as 2014.
And also, you can go into the My Benefits whatever thingy from the Benefits Center, and you can eventually hack your way down to a place where it shows the current status of your.
You want to look for, it's called Your Spending Account, which is another division of Aon Hewitt that actually administers the HRA account.
Your Spending Account. That's the secret code word.
Your Spending Account administers the HRA, YSA.
What is the Aon tool to compare the offered HP plans versus the Aon Exchange plans?
So the tool is we basically look at premium. The main things people look at is premium, if there's a deductible not in the group plan, and what people are concerned about is how much is it going to cost me if I go to the hospital, the doctor, and how much are my prescription drugs going to cost me as well. We look at that, and then we look at the individual Medicare plans. In addition, if you qualify for an HRA, how much dollars you have in that. And keep in mind, let's say, I'm just saying, for instance, you're paying $200 a month on your HP plan right now. That's $2,400 that's going back in your pocket that you can use towards towards healthcare expenses on the individual side as well, in addition to the HRA dollars that you may qualify for as well. So that's how we separate the two and basically do a cost analysis to figure out, does it make sense for you? So there are people, for instance, that let's say you're taking a lot of expensive prescriptions. One thing the HP group plan does not have is a donor hole for their drug plan. On the Medicare Part D plans and the Medicare Advantage plans that include drug coverage, they have the donor hole, which could potentially cost you a lot more money compared to the HP group plan. So that's another thing we look at.
On the HPA benefits forum, some members reported that in analyzing their drugs, analyzing their situation, it definitely made sense for them to stay on the HP group plan.
Yep.
And really, you're the one who has to kind of figure that out. And it's not obvious. Again, that's another reason for being on the benefits forum to talk this stuff through.
We definitely, one of the things is if you are concerned about drug costs, you can provide us your drug list, and that really gives us a really good understanding of how much your drugs are going to cost you for 2015 in the individual Medicare Part D plans.
Right. And the other issue people are talking about, by the way, is out of network, which is becoming more and more of an issue. It was a New York Times article a couple of weeks ago. You go to the emergency room, and it turns out that even though the hospital's in network, all the people who worked on you are not. And that's becoming an issue because they're itinerant doctors who are paid huge rates. So that's another issue to be aware of, is this whole in-network, out-of-network.
Well, let me add on that. So during the needs analysis, if you have doctors, and this is really for if you're looking at Medicare Advantage plans, because those are network-based plans, unlike the supplement plans, where it's simply as if the facility accepts Medicare patients, you can go to anybody around the country. So for Medicare Advantage plans, we have tools. We simply put in your doctor's name or the medical facility as well, or the medical group, and we'll know if that Medicare Advantage plan accepts that plan or not, or it's in network or not. One more thing about the drug plans. Another thing when we're going through the drugs is we ask you, do you prefer to get your drugs filled through the pharmacy or through mail order? Because most of the plans offer 90-day supplies at a discounted price through mail order. We also, you can choose either, you can use both. I mean, some for maintenance drugs, you do mail order. Some that just come up, you go to the local pharmacy. And we'll ask you what pharmacy do you go to, because that also helps us determine which plans we should be looking at. So, because some pharmacies are in network on plans and some of them are out of network. And if they're out of network, it costs more money than in network.
Yeah, it can be a real trap. For Connie, after 2 years on disability under 65, are you eligible for supplemental insurance?
That because when you get Medicare Part B, there are certain companies that will sell to people that are under 65 and disabled. And some of them have that open enrollment period. So one of the things that for a person, once they are on Medicare, if they are under 65, they will be able to get a supplement to Medicare. However, it will probably end up costing more money than it would for a person that is age 65 and older. And so once they become 65, at that time, they have an open enrollment period, which every company must accept them at their premium.
And let me add on that. There are states where, by law, they don't offer under 65 Medicare supplement plans if you're disabled. And the majority of companies that do, it's a lot more expensive than if you're 65, because they know that there is some kind of health issue involved. That's why they jack up the premium.
Right, and even for California now, there's very few companies that offer.
Yeah, and they're expensive.
And they're very expensive.
It could be double or more the premium of a 65-year-old.
And some of them, and that's very important for them to just remember the 6-month open enrollment, because once that period is over, they don't have to accept you.
Okay. Yeah, the time limits on all of this. And by the way, I would put in a pitch, the Medicare and You booklet that's online, and you also get it mailed to you.
Right.
And what I found with complicated booklets like that is if you go online and use a PDF reader, you can search. And then take a yellow pen and mark up the paper copy once you figure out where the heck the information is that you were particularly looking for.
And one of the things I would like to add, with the SHIPs or the high caps here in California, what we do is we provide unbiased and objective information. We don't charge anything. We cannot tell a person what to do, but we can certainly educate them. So this is also one source where they can go ahead and get information that's free of charge. And like I say, we're completely unbiased and objective. We do not endorse any organization. So it's one place where they can come for help.
Now, here's someone who took EER in 2012, won't be 65 for another year, but husband will be 65 later. Will I need to keep HP retiree medical until he is 65?
I would recommend doing that.
Okay.
Because if you leave, is the retiree over 65? She has one more year, right?
She has one more year to hit 65.
But is her spouse younger than her?
Younger than her.
Okay. So I'd recommend her to stay on the HB plan after she turns 65 until her spouse turns 65, because if she leaves, he's going to get kicked out of the HB plan.
Okay. If we had taken early retirement from HP some years ago, then worked elsewhere until retirement at age 65, how does that affect options for the Aon service?
It doesn't at all. In terms of options for plans, as long as you have Medicare A and B, that's all. Then you have as many options as anybody else.
And you will hear in the mail from Aon Exchange.
Yes.
And watch out for it, because the Aon Exchange mailings look pretty salesy. I've been bugging the Aon people about it. They look pretty salesy. They look like a lot of the other stuff you get about health coverage. So be alert to the fact that the Aon related to HP stuff doesn't look like the regular HP stuff that's very clearly from HP. Got to keep your eyes open on that. Here's same. Is Aon only for retirees, or can anyone use it? Go ahead and repeat that point.
So the Aon Retiree Health Exchange, as long as you have Medicare A and B, so you can be disabled and under 65, and as long as you have Medicare A and B, you can work with us. That's the main rule for working with the Aon Retiree Health Exchange.
And do you have to have received your Medicare card before contacting Aon?
No. So, because you usually get your card around 3 months before the month of your birthday, but sometimes it comes a little bit later. It is you automatically get A and B if you are taking Social Security. If you're not, then you actually have to contact Social Security to set up A and B. But if it's 3 months before the month of your 65th birthday, we know that window's starting, and that's when we can start talking to you about plans.
Right. And here, I know the answer to this one. Does the information package go out to all HP retirees before their 65th birthday? Yes.
Yes. Yep.
Yes. And
as long as they're on file.
I've not seen members complain.
Yep.
Obviously, as long as the benefits center has your current address.
Yep.
You have to change your address with every one of HP's different outsourcers. Okay? This is a worldwide cloud database company that can't seem to change people's addresses. So you need to be very alert on your stock, everything. When will you be in Boise?
I will be in Boise November 4th.
Okay. And in the HP Alumni News Flash, I put out a list of the different cities, locations, and dates, and I'll be putting out a revised one in a couple of days. Is there any way to actually determine the actual amount of subsidy provided by HP for a specific HP plan and a specific employee?
I will answer that. So HP has, in terms of the HRA subsidy allocation that you could qualify for, a lot of it has to do with the years of service. There's 10 years, 15, 20, and 30 years. Obviously, the more years, the 30 years get the most. There's also digital retirees that get a different amount as well. So the formula, I can't give you specifics on that, but again, if you call up the Aon Retiree Health Exchange, we can give you the actual dollar amount that you could use for next year.
Thank you, and look forward to it, David. I was an HP retiree. Okay, so I'd like to thank Addison Avenue, First Tech Federal Credit Union, Scott Hamaguchi, in sponsoring this event. We want to thank the First Tech IT group. This went really, I am impressed. This went really well. And, of course, we have a special thanks to Connie Corrales from HighCap SourceWise and David Rue of the Ian Hewitt Healthcare Exchanges for sharing their evening with us on the first day of the World Series.
Go Giants.
So, and obviously, thanks to Kurt Gown for setting up all the advertising and IT setup for the members. And I know HPers are very much do-it-yourselfers. And as a financial advisor, I would like to encourage you to take advantage of the Ian Hewitt Healthcare Exchange and also use their benefits advisor and advocacy for ongoing support. And for members outside California, check out the shiptalk.org, all one word, ShipTalk, website for your local Medicare counseling program. Again, both presentations will be made available to you as well as the link to the recording. That's great. And as I mentioned earlier, we would like you to email your key insights that you gained from the event to editor@hpalumni.com. And lastly, if you go to the hpalumni.com website, under Contact, there's a listing of all the volunteers and their responsibilities that make this HP Alumni Association such a valuable member to your personal network.
This event is organized by the 25,000-member independent Hewlett-Packard Alumni Association, operated by former employees who volunteer their time, not endorsed or supported by the Hewlett-Packard Company. We help each other with life after HP, particularly the finance and benefits discussion forums, which we've referred to several times. And if you know someone who's leaving HP, our website has a checklist of things they need to do as soon as they know they're leaving before they lose access to HP's systems. We're at hpalumni.com. Thank you.